It's a pleasure for me to be here. I've been looking forward to this for a while. It's definitely a timely topic. I know for me, I've been on Zoom for a long time, and I am starting to experience all of these symptoms of eye strain, headaches, neck, and jaw pain. So I am happy to share my information with you today and help you to prevent it. So here we go. All right, so just to begin with, approximately, and I'm sure that since this 2020, these numbers are much higher, but approximately 75% of US adults own one or more computers. And the average adult, 18 years or older, spends more than 11 hours a day engaged in digitally based activities, computers, cell phones, television, etc. That's a lot. I think that's an extraordinarily a long period of time. So, in doing so, and in spending so much time on the computer and other types of electronics, what's happening more and more are people are developing work-related musculoskeletal disorders. They're developing posterior cervical dorsum syndrome or computer back, mouse shoulder. And what we don't think about often is not only are they developing problems related to the neck, but the relation of the neck to the rest of the face. So having neck compression throws off your entire oral cavity. So you get occlusion dysfunctions, you get temporomandibular joint disorders, you get myofascial pain syndrome. So we'll go over that. And then we're going to take a little break and we'll start looking at the internal stressors and systemic health. So we're going to look at digital eye strain. Now, computer vision syndrome is huge right now, particularly the controversy around the effects of the blue light from the computer and the harmful effects that might have on your eyes. So we will talk about that. And there's a new type of headache that is around. It's called trigeminal dysphoria, and that comes from computer vision syndrome. So we'll look at the link between those two and talk about those a little bit. And then I don't know about you, but people who are on the computer before they go to bed, and that's even checking your emails before you go to sleep, you can throw off your circadian rhythms. It compromises your immune system. There's a huge relationship between weight management and circadian rhythm cycles. And now we're even starting to see, particularly in young adults, psychiatric problems. And then we're going to wrap it up in the systemic effect that it has on your whole body in terms of aging. And so we will look at that as well. So just to take inventory, do you look like the person in the green check box or in the X box? So take a look at how you're sitting. Are you sitting comfortably on a chair, ergonomically positioned, or are you on your bed with pillows propped up with your feet up and your laptop on your lap? Or are you sitting there on your phone with your head tilted down to your chin? Which one are you? And if you are the one in the check mark, that's great. And if you're in the person in the X, pay attention. Or even if it's your patients, we're here to treat our patients as well. So when you are treating your patients, this is something that they're going to need to know. And if they sit like the person in the red X, here are some tips to help improve their health and well-being. So when someone has that forward head posture, similar to what you just saw, what we see is the center of the weight of the head is anterior to the trunk. So you see the arrow in front of the ears and where the weight of the head is relative to the cervical spine. That head position has a huge impact on the head tilt force of the neck experience. So for example, if someone's head is ergonomically situated on top of the cervical spine, the head of the weight, think of that your head is a bowling ball. So the head weight, or the experienced weight of the head by the neck, is about 10 to 12 pounds. Well, every time you shift your head forward a matter of 15 degrees, that perceived weight of your head, your bowling ball, on your cervical spine increases. So at 15 degrees, it feels like your neck is supporting a 27-pound bowling ball. At 30 degrees, your neck experience is as if you were carrying a 40-pound bowling ball. Look at 60 degrees. This is not an uncommon posture. How many times do you look at your phone and your head is tilted at this angle? Well, you are putting a perceived weight of 60 pounds on your cervical spine. Now, when you have that amount of weight, perceived weight, balancing on your cervical spine, there are a number of conditions that are linked to that. And we are going to work on today we're going to go over the ones from the neck up, but conditions like headaches and migraines, dizziness, vertigo, TMJ, shoulder and rotator cuff problems, chronic cough, upper and lower back pain, sciatic pain, neck pain, pain radiating down into the arms. You can even get degenerative disc problems. And then because your weight is folded over, you can get acid reflux. It affects your digestion. It affects your sleep. It affects your wrist, carpal tunnel, and then the underlying any type of chronic fatigue problems and vision problems. So just to get on the same page, let's look at the 11 bones of the skull, the frontal bone in the front, the parietal bone towards the back, the occipital bone at the base of the skull, temporal and sphenoid bones on the side. The zygomatic bone is that bone that defines your cheek area. You have the bones of the eyes, the ethmoid, the lacrimal, and nasal bone. And then you have the two bones that make up your jaw area, the mandible, which is the one floating bone on the face, and the maxilla. In the back, we have your 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae. You have your 5 sacral and your 4 coccygeal bones. And all of these bones are supported by muscles. So the face is very unique to the rest of the body. The face has 2 sets of muscles. It has deeper muscles and it has superficial muscles. The superficial muscles are called the mimetic muscles. We'll talk more about them later. But what's unique about this set of muscles is, unlike the rest of the body, these muscles do not cross joints, and they function to either open or close the apertures of the face or to tug on the skin. So the orbicularis oculi, the orbicularis oris, they're all positioned to either move the eyes or move the mouth. And then they also create expressions on the face. Of particular importance to us today, we'll be talking about the effects of the temporalis muscle on the side, the masseter muscle in the cheek, and the sternocleidomastoid muscle, which runs along the side of the neck. On the front of the neck, there are 2 sets of muscles that are particularly important. They're the hyoid muscles. You have the suprahyoid muscles, which indirectly attach inferiorly to the hyoid bone and superiorly to the mandible. So they lock into the mandible. And then you have the infrahyoid bones, and these indirectly attach superiorly to the hyoid bone and then to the center of the clavicle. Of particular importance for us are these. They're the 3 muscles of the suprahyoid muscles, the mylohyoid, the digastric, and the geniohyoid. And the reason why they're important is because of the impact they have on the lower jaw, the mandible, which is attached to the temporomandibular joint. And then the muscles along the back of the neck, the trapezius muscle, the large muscle around the shoulder area, and the splenius, capitis, and cervicus that support the neck area in here. The type of computer that you use makes a huge difference in terms of the impact of the strain that sits on all of the muscles of the neck and the face. One very interesting study is an observational study that compares the posture of one individual in 4 different conditions. So in this observational study, they took 30 participants. They asked them to do a 5-minute task in 4 conditions: sitting at a desktop computer, standing with a desktop computer, sitting with a laptop, and sitting with a tablet. And then they monitor them with a 3D motion analysis. So in A, figure A, this is the person with the tablet. The person in B is the laptop. C is the desktop in a seated position, and D is the person standing at the desktop. And they're monitoring them. What they found is there was no meaningful difference between posture between the sitting and the standing desktop. You can see their posture is fairly symmetrical, fairly stable. However, using a laptop or a tablet computer significantly altered the posture, resulting in greater neck, elbow, and wrist flexion and shoulder elevation when compared to the desktop users. Now, what's interesting about this is the trajectory of what is happening over time. So from 2010 to projections of 2023, the shipment forecast, or the number of electronic devices that are being purchased in millions, goes from 157 million desktops. The blue is the desktop, the black is the laptop, and the gray is the tablets. Look at the change in trajectory of sales in over 13-year period. Desktops are going down, laptops and tablets are going up. So in fact, this problem is getting worse, not better. I use a laptop. I don't know about you, but it's what I love about my laptop is that it's very portable, it's lightweight, it's safe space. You can work anywhere, anytime. I don't know if that's an advantage or not, but that's the reality of it. What's difficult about the laptop is the way that it's designed is the screen is joined to the keyboard. So it's impossible to separate or adjust the height and the distance of the keyboard to the computer. The effect that you get from leaning over, looking at your laptop, unless you actually have it elevated and supported in an ergonomic position, the effect that it has is what's known as posterior cervical dorsal syndrome, or computer back. If you look at the image, that's a fairly exaggerated position, or not. I don't know. It depends upon the person. There are significant changes that happen in regard to the ergonomics and the effect that that has on our musculoskeletal system. So just looking at this person, you can see muscle tension in the neck. You can see the concavity of the chest, or the folding over into the chest area. You can see the shoulders are lifted. The arms are in a stress position, particularly the forearms. Look at the back area, how hunched over, how the increased loading on the intervertebral discs of the spine. You can see the joint dysfunction and potential sprains of the neck area, the back, and the ribs. And then looking at that positioning, the impaired diaphragmatic breathing caused by the overactivity of the upper ribs and the shoulders curving over. In addition to your posture is how you adjust your mouse. So this particular study looks at mice with different slanted angles versus flat. They took 12 subjects, asked them to perform the same text editing task with 5 different slanted mice. And then they measured the activity of the extensor carpi ulnaris, the extensor digitorum, pronator teres, and the upper trapezius muscles. What they found, which I think is very interesting, is that as the slanted angles increase, the surface in terms of the extensor carpi ulnaris, pronator teres, and upper trap muscles decreased. However, increasing the slant angle resulted in larger wrist extension and higher muscle activity in terms of the extensor digitorum muscle. So the takeaway, or the interpretation, is working with the mice, which have a suited slanted angle, provides users more neutral hand position. Neutral hand position is the key. So I don't know if you can see me with my mouse here, but you want it to be in a fairly relaxed position like this, similar to what's in the picture. in the picture. So for what works for one person may or may not work for the other. You want if your arm is longer or your hands are longer and fingers are longer, you might want something that has a little more of a slant. Whereas if your fingers are shorter, then you probably need something where the slant is not as angled. Okay, now we're going to practice. So we just went through the basics. Now let's actually practice. So I'm going to have you stand up. Get out of your chair, off your bed, out of your comfy couch, whatever you want to do. Stand up and let's practice sitting in an ergonomic position.